For all the hours Ryan Brill spends on the playground, he knows it only takes a split second for something to go wrong. Just weeks ago, Ryan fell while playing on one and ended up in the hospital with a badly broken leg.
You just don't think about stuff like that when you let your kids go out and play on a playground. It's just something you just don't think about.
Unfortunately, it is something Dr. Kathy Nuss thinks about, especially this time of year. She and her team at Nationwide Children's Hospital have charted injuries that cause kids to be hospitalized. Nuss, who is also with Ohio State University, says there are some very familiar seasonal patterns. Consistently topping the list of the top 5 ways that summer injuries occur are falls. Things like trampolines can prove dangerous, but most often, as in Ryan's case, injuries come from things that parents may assume are much safer.
Kids tend to be top heavy. Our younger kids fall and hit their heads a lot, so we see a lot of head injuries. In the summer, though, we see a lot of falls from playground equipment.
At number 2 are bike injuries, usually from kids not wearing helmets. Also, injuries on motorized vehicles like scooters and ATVs. Burns are in the top 5, but not always from fireworks. This is an injury that differs according to age groups and may be something parents don't often think about.
With the younger kids that are climbing or pulling food off the counter, they tend to get scald burns. Our older kids, particularly in the teenagers, most of their burns are sustained from direct contact with fire.
Vehicle accidents round out the top 5. While kids have little control over them, they can be made worse for kids if parents don't use car seats properly.
Doing good on them.
Doctors say you may not be able to avoid the top 5 causes for injuries entirely, but keeping a close eye on your kids this summer is the one thing that's sure to help. At Nationwide Children's Hospital, this is Clark Powell reporting.